my name is Rod Wells. I'm with East Anglian Air Ambulance. Fortunate enough, I've been with them for nearly 10 years now. Part-time initially, doing the odd shifts, or about 2 or 3 shifts a month, and now sort of been on for 2 years as full-time critical care paramedic, HEMS trained. As part of my role, I obviously not just to be in the aircraft and look after patients, I need to get the pilot there first. So there's a little bit of working out between the two of us and doing navigation. Obviously it's not so bad during the daytime. At night time we obviously have to sit down and plan the job before we actually fly throughout the night. And obviously once we get there, the landing, sorting the landing zones, and then going with the doctor to look after the patient. It's taken some time to get fully trained, it does all of us, because we have additional skills up and above the ordinary paramedic. Otherwise we are proper paramedics, but we have, as I say, additional skills, pain relief, sedatory skills, and advanced airway skills also that we bring to scene and bring to the patient. As part of my role as a critical care paramedic, my other tasks are to go into the local control room and monitor all the 999 calls that came in. So we filter all the 999 calls that come in just to see which is the most critical really, and to see what needs they may have, whether it be a critical care paramedic on the ground or a critical care paramedic as part of the hospital or doctor team on the aircraft here. I tend to do that about 3-4 times a month within my role. As being a critical care paramedic, it's very challenging. I've been with the ambulance service for 25 years, and as I said, been on the aircraft off and on now for 10 years. It's more challenging in the fact that we go to the higher acuity calls really, a lot of critically injured or ill people, as opposed to being on the road where they have a big wide spectrum of calls. It's certainly challenging, every patient is challenging, and I think also with this role it keeps me up to date with modern day thinking, lots of study, lots of education as well. Most of our calls originally were for road traffic accidents, and I think over the last couple of years we've seen that changed to probably cardiac arrests is our main focus of calls, secondly by road traffic accidents, and then equestrian accidents. I believe we've changed and moved over the last 2-3 years, and I think this is because we've got our own designated control area now, and we're looking at the cardiac arrests that come in, and we believe that we can offer a little bit more. So we send the team along. I mean, obviously the ambulance service will be there doing a great job as well, and we're just coming along just to see whether we can actually help them. We have a little bit more equipment, a little bit different drugs, a proven device for cardiac arrest, which is an ACD, and 2 or 3 different more drugs that we can probably come along and offer some help, and hopefully get a better outcome.